Good evening. Welcome to Sound Health on Lagos Television. I am Olasumbo Modupe. We bring you Sound Health every Tuesday on Lagos Television. Last week, Dr. Olufemi Adeyemi, a public health physician and a UNICEF health specialist, shared his expertise on the recently released United Nations Interagency Group Global Estimation for Child Mortality. Stay tuned as we bring you the concluding part.
Every day, a lot of babies are dying in front of our eyes. We cannot make anything to them. Really, please stop this war. If you discharge him today, he will come tomorrow with cold injury or sepsis or pneumonia or severely dehydrated or even die already. Our baby right now need mechanical ventilation, and there is no enough mechanical ventilation. As you see, all the mechanical ventilators are fully occupied. More than 2 to 3 patients in each incubator. The situation here is more than catastrophe.
This is Al Emirati Maternity Hospital that caters for at least 83 deliveries a day, of which 15% of these deliveries are cesarean section. There is insufficient bed capacity for post-op care. Mothers are being discharged 6 hours post-operation to living conditions that do not meet the hygiene standards. That means lack of water, lack of sanitation facilities, lack of hygiene products for the mother and for the baby, and this exposes the newborn to a number of infections.
The mother cannot find even the food to support herself to feed her baby. The situation is more catastrophic. The situation is horrible, really.
Yeah, I was saying that we need to strengthen data and statistical system. Whatever thing that we do that we do not monitor, it's not done. It's just like wishful thinking. So whatever thing we need to do, we need to monitor and ensure survival of every child, including the most vulnerable. The gaps in data are filled, and then we keep on monitoring to ensure that everything that we have planned is totally done the way they're supposed to be done. And of course, we need to allocate appropriate resources to reduce underfunded deaths. And when we are talking about appropriate resources now to reduce underfunded, we are starting from the community level. The lowest community, we talk about LGA in this part of the world, but we need to even go beyond the LGA and go to the world level. It is from the world level, that is the grassroots. When you look at the way things are done from the ground, when you're talking about a bottom-up approach, everyone is already taken along. So when you do that, whatever plan you are planning is encapsulated and emanates from that grassroots, and it goes upward. That is bound to improve newborn and child mortality. And then, of course, it is from there you can ensure that you have adequate financing. Like in our country, Nigeria now, we know that health insurance is mandatory for all. And that is the easiest way to ensure that, one, people have access to health. And like it is also said, a proper health insurance is also like a buffer against poverty. Because what that is very rich today, with a small ailment without any health insurance, can become poor just with a snap of fingers. Thank you.
Okay, I'm glad you mentioned that we need to intensify efforts at the grassroots. Looking at the indices from the report by the IGME now, it is multi-layered. It cuts across not just the under 5, it cuts across children, adolescents. What should we be doing now in terms of reaching out to these people that are affected, apart from the under 5 that cannot decide on their own? The adolescents are also affected now, in addition to about 16 million children, to that fact you raised earlier. 16 million children and adolescents will be affected by 2030. Should we bring them on board to change the narrative, in order to change the narrative now?
I think that is actually non-negotiable because it is when we bring them on board that we're likely to get there. There's a general saying that you cannot actually barb someone's hair in his or her absence. It's when everyone appreciates the magnitude of what we have. And we remember now that even the youth, they are far, far, far more innovative. I'll give a very simple example, a very simple analogical example, and I want it to be as simplified as possible. Let us assume, for example, that out of every 100 pregnant women that get pregnant and want to have their baby, let us assume that 30 out of the 100, it's an assumption, 30 out of the 100 die. And we, as physicians, now come and say, look, we now have a solution that instead of there's something we can do that only 15 will die out of 15 out of 100. That means that we now say that instead of 30 dying, only 15 will die. Let us now go to the community and provide this and tell them exactly what we think. And let us ask the community, for example, who amongst you men who wants your wife to be one of the 15 that will die? Do you think you will get an answer for that? Pardon me?
Of course, no one would like that.
Hello, do you think you will get an answer for that? Fine. So what that means is this. If we know what works, let us table what works. Let us dialogue with the community. Let us dialogue with those at the receiving end, at the lower end, that look, this is the situation we have. How do we go about this thing? You'll be surprised that communities that do not even have community health extension workers, that does not have any community health workers with their WDC, that World Development Committee and all that, can start nominating people among themselves. So we need to sponsor these people. We need to support these people to get empowered so that our community can become what it's supposed to be. So it is not only government now. Every one of us are stakeholders that need to come on board to address this issue.
All right, Dr. Adeyemi, your call to action now as we wrap up.
Yeah, my call to actions I've actually, enumerated it when I was actually talking. We cannot underplay the fact that we need to have that local action. Number one amongst it is the political will. Once we have the political will, we put our words and our belief on where our money mouth is and put our money there. Things will start happening from there. So we start planning from the very grassroots. We talked about adolescents now and young persons that they have to be involved. The community has to be involved. You cannot be planning for the community outside of the community. So we need to do that, the planning from that level together. So they all appreciate. The community needs to own what is happening within their environment. And from my own experience, by the time the community owns what is happening, they fly. But once you bring something that is already tailored and you think you want to stop it down the community without the buy-in of the community, most of the time it's a wishful thinking. And then, of course, I did talk about ambition. Do we have anything to lose by being over-ambitious? If we say SDG is 2030 and we'll see what is happening now, okay, fine. We can even set our own target and say, look, we want to meet all the SDG goals before that 2030. What are the things that we need? What do we need to reduce neonatal mortality rate? How do we ensure that everyone in our community have access to skilled birth attendants, from professionals attend to them at birth? How do we ensure that every woman that gets pregnant gets to the hospital? And not just really getting to the hospital or the health center, it gets there. And everything that we promise to be available, everything's available there. It's a one-stop shop. When that happens, it will encourage more people to go. I hope I'm coming clear.
Yes, you are communicating.
A very, 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 very potent intervention, high impact intervention for children to survive is immunization and nutritional feeds or nutritional supplements. But most of the things, you can imagine how many children survive by just deworming them. Just ordinary deworming. How many children get so very, very intelligent because you give them the right quality. I'm not talking about quantity now, quality of food. Now, I talked about strengthening our systems. Instead of just having facilities that are just glorified structures. You understand me? We have a facility that, look, you go there at any time in the day, there's someone smiling, there's someone there to attend to you, and the place is well funded. The people working there are happy. Enabling environment. So before in doing our plan, we are planning from the moment the child is conceived, all the way down to not just when the child is born. By the time the child is born, don't just fold your hands. That child that is born, remember, we said that child has to survive and that child has to thrive. So it's not only health now. We're talking about education, we're talking about upbringing, we're talking about the social norms that surround the child. A lot of the all speak with one voice. It is achievable. And like I've told you, all these things without heavy investment in the community, I don't really see it seeing the light of the day. The game changer I have seen that I've identified in my works in public health is heavy investment in the community. We need to empower the community. They need to know what is available, and they need to know how to assess what is available. Look at what is the number of people that are even insured now in terms of health insurance in the country? It's still a far cry. And that is one pool of resources that is waiting to be tapped. And when we talk about insurance, we all know it's a game of numbers. It's a game of numbers. If you are talking about having just about 250,000 people on health insurance, you'll be struggling. But if you have about, say, for example, 5 million or 10 million within an environment, it will be great. We can even talk about health insurance, community-based health insurance. And we have places in the world where that has been done and things are working, and you can start seeing the indices changing at a very phenomenal rate. What data? We're in the days of IT, information technology. So data shouldn't be an issue now. Data can start, we can be able to access data and start assessing that data and getting it directly from the source where it is being generated without all those other usual opportunities that we used to have. And when you have good data, that means you can plan very well. It's that when you're talking about the country, if you don't know the population of the country, how do you want to plan for the people in the country? So the same thing with health. The people you want to plan for, it is data that will drive whatever thing you want to do. You should be able to put them side by side. And of course, if you permit me to round up with this, healthcare financing, the bane of healthcare financing today is health insurance, especially for the very vulnerable. You remember I did mention the fact that the way I say, almost everyone is vulnerable. Anyone that does not have health insurance is actually vulnerable. But even among that vulnerability, we know that children and pregnant women are still more vulnerable. But when you look at the middle class we have today, say for example in this country, the middle class that doesn't have any form of health insurance and then thinks is doing well, all it needs to do is to have a little ailment. A little ailment, and the saving of 10 years can be wiped off in less than a month. So do we have to go that route? We don't have to go that route. So health insurance is non-negotiable for every citizen of this country. But then most of the time, what we have done thus far is that we tend to, you see that health insurance seems to be getting its footing in the very formal sector, which can easily be regulated. But where you really have the issue is the informal sector. Those are the ones that we need to bring on board. With a simple policy, you can put all those in the formal sector to have one form of insurance or the other. Fine. But they are just a drop in the ocean when it comes to the informal sector in a place like Nigeria, and just not only in Nigeria, in the sub-Saharan Africa, because it's a similar thing we have all over the place.
Thank
Thank
you
you.
so much, Dr. Olufemi Adeyemi, a public health physician and health specialist, UNICEF, with the UNICEF Lagos Field Office. We really appreciate your time.
Thank you.
All right, you're welcome, sir. Everyone is vulnerable. Every life matters. Sufficient funding, planning, adequate planning, and collaborative efforts will actually help us move closer to achieving the SDG goals and targets by 2030. Dr. Adeyemi has been analyzing the recently released United Nations Interagency Group for Child Mortality Estimation, and we are hoping that we'll bring him back on board to analyze fully the 96-page report because it was recently released. Thank you so much once again, Dr. Adeyemi.
Thank you very much and have a good evening.
All right, Sound Health continues with trending health report from around the world. Please stay tuned.
Hey bartender, you assume that I cannot drink a margarita, so you don't serve me a margarita? So I don't drink a margarita. Your assumption becomes reality. And parents, you assume that I cannot live on my own, so you don't encourage me to live on my own, so I don't live on my own. Coach, you assume that I cannot hit harder, so you don't train me to hit harder, so I don't hit harder. And teacher, you assume that I cannot learn Shakespeare, so you don't teach me Shakespeare.
Old MacDonald had a farm.
So I don't learn Shakespeare. E-I-E-I-O. But hey, if all your assumptions become reality, then assume that I can drink a margarita. Will you serve me a margarita? So I drink a margarita. Assume that I can live on my own. So I live on my own. Assume that I can hit harder. So I hit harder. Assume that I can learn Shakespeare. So, what fools these mortals be? I learned fucking Shakespeare. You assume I can swear, right? Assume that I can do that job. That I can go to parties. That I can have sex. That I can be on stage. Assume that I can. So maybe I will.
We have been discussing how to reduce child mortality in Nigeria. Every life matters, no matter where a child lives or no matter where a child is born, regardless of status. Every life deserves to live. For comments or inquiries, or you have topics you'd like us to treat, please send SMS to 0035 826603 or follow us on social media at LTV Social, #SoundHealth. A sound health is a sound mind. Make healthy living your choice.